we are going to be looking at the Regional Action Plan for Digital Health in the European region of the WHO 2023-2030. So, yes, today we already reflected upon this issue with the presentation that we had from our guests in order to fuel the debate. And at this juncture, I would like to open up the floor to hear your comments. I have the honor, first of all, of giving the floor to Czechia, who is speaking on behalf of the EU and its member states. Czechia, please.
Madam Chair, distinguished Regional Director, Excellencies, colleagues, I have the honor of speaking on behalf of the European Union and its member states. The European Union and its member states welcome the Regional Action Plan on Digital Health and its strategic priorities and guiding principles. Digital transformation in the health sector has become indispensable over the past years. Good and reliable digital health governance will be key for policymaking and community buy-in, but remains a challenge in many countries. Norm setting and solid privacy standards will be crucial to drive transformation while putting the patient at the center of all interests, encompassing a prevention-focused, human rights-based approach, fully respecting the values of solidarity and equity. Individuals, health workers, and patients should be empowered through digital health to make informed choices based on mutual trust. This will be key in achieving universal health coverage. The digital health space is moving fast, and it is crucial to adopt and adapt existing guidelines in order to respond to an evolving environment with new expectations and needs. Safe health information and data platforms, clarity of the ownership of the non-individual data, and innovative knowledge sharing will be needed to satisfy the growing demands in digital health. Promotion of digital inclusion and addressing the needs of those in the most vulnerable situation contribute to the achievement of health equity. All sectors, including the private sector, can play an important role in new health technologies. The number of companies with a digital focus is constantly increasing. New innovative and smart health products and services centered on personalized and digital medicine are being developed with unprecedented speed. Investment in research and biomedicine will be key factors to contribute to improved effectiveness and health outcomes. Ensuring that no aspects of health system are excluded from digitalization will lead to a successful digital health era. Furthermore, international cooperation will be critical to implement the WHO Euro Regional Digital Health Action Plan. For many years, the European Commission, through the e-health network, has played an important stewardship role by advancing a common agenda for digital health and data governance adoption in EU member states, paving the way for increased sharing of health data and the setting up of the European health data space. In this regard, we would like to highlight the importance of the development of digital health standards, including a standardized nomenclature for effective cooperation. A comprehensive evidence-based and digital data will help ensure that digital technologies contribute effectively to health outcomes while minimizing potential risks, and that decisions and investment relating to digital health are sustainable, evidence-informed and driven by accurate data, needs and by lessons learned. In that regard, we are looking forward to working together with all partners across all sectors to enhance evidence-based platforms, share knowledge and good practices, and further explore opportunities to take concrete steps that contribute to the achievement of interoperability across borders. The European Union and its member states also very much appreciate the illustrative actions recommended by the Regional Action Plan, and we are looking forward to work closely with the WHO Euro Office to carry some of these actions forward in 2022 and 2023. Thank you.
Thank you very much to Czechia. I now would like to give the floor to Norway. Is that a group declaration as well, a group statement, Norway? Or is there another group statement?
Thank you, Regional Director, colleagues. I make this statement on behalf of the 8 Nordic and Baltic countries, namely Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, Sweden, and Norway. The Nordic and Baltic countries welcome the Digital Health Flagship Initiative in the European Programme of Work. Digitalization has become an essential part of our society as well as our health systems. However, there is still a long way to go to achieve transformative change. Digital technologies is a key tool to securing sustainable health systems and a patient-centered approach. It is also important to secure patients' trust in digital solutions. This has become especially evident during the COVID-19 pandemic and other emergencies. Beyond health services, it is important to pay attention to the benefits of digitalization on health and well-being through the life course. To enhance health equity, digital inclusion must be a key principle. We know that the use and implementation of digital tools varies across member states and across population groups. With the significant cross-border exchange in our region, it is necessary that we harness the lessons learned in digitalization to increase the use of tools that are accessible to everyone, while not compromising on data security. We are glad that this is emphasized in the plan. We are particularly pleased that the plan now also includes a role for WHO in expanding the evidence base. By accelerating the development and adoption of sustainable person-centric digital health solutions, we believe the plan will contribute to improving health outcomes and achieving policy objectives in the region. WHO leadership, strategic direction, and technical guidance will be very valuable to support countries in the digital transformation of health systems. Sharing experiences and use of digital health tools is key when it comes to implementation of digital technologies. In that work, we have to consider the cultural transition as well, and to be transparent and talk about the necessity of digital health to be able to meet challenges as demographic development and health workforce deficiency understaffing, to provide good health care both today and tomorrow. Investment to the interoperable health information systems, common standards, good governance, capacity building, and empowering the end users are essential components for the success of digital health uptake. Integrating digital technologies into the daily workflows of medical practitioners and making them user-friendly will facilitate uptake, enable smart use of generated data. Only by demonstrating the added value for the everyday work of healthcare professionals can we be successful in bringing these tools to everyday clinical practice. With data increasingly flowing across borders, the development of artificial intelligence and robotics require international discussion and coordinated approaches. These factors and the role of WHO are well taken into account in the action plan. We also support the element of seeking synergies and cooperation with EU and other international organizations to make sure that we implement digital solutions that work, minimize risk, and ensure better healthcare. We look forward to close collaboration on the implementation of the plan and would like our 8 member states to be registered among the co-sponsors of the resolution. Thank you.
Merci la Norvège.
Thank you, Norway. I now give the floor to Israel, to be followed by Poland and then the Russian Federation. Israel, you have the floor.
Thank you. On behalf of the Ministry of Health, I would like to congratulate our colleagues at WHO Europe for their tireless work over the past year in compiling this resolution and the work plan. We are honored to take part in this important work. Digital health has proven critical in both combating COVID-19 and continuing to provide care in accordance with social distancing. Digital health technologies are transforming healthcare delivery around the world. Countries with well-developed universal health coverage systems can become more efficient, more patient-centric, and more resilient. For those who are still in the process of expanding healthcare services, digital health can be a springboard for increasing services and public trust. This is the promise. But we are all facing similar challenges in this relatively new field. It is interdisciplinary by nature, requiring an extensive ecosystem to flourish, and comes with no instructions or textbook. Moreover, digital health transformation requires us to redesign healthcare services and rethink clinical practices, requiring substantial investments. This is not just theory. It is an adaptive challenge we are all facing all at once. The current resolution emphasized the importance of sharing knowledge and best practices in implementing digital health strategies. Israel is always seeking to collaborate and learn from other countries. The resolution highlights interoperability and data quality as the cornerstones of digital health. We must work together on a global level to harmonize standards and to invest in health data governance. This will enable us to use algorithms and digital health tools in hospitals and primary care seamlessly. The resolution declares the establishment of the Strategic Partnership Council, which will enable us to scale up digital transformation in healthcare. The most important step we can take is to bring everyone to the table. We should bring the industry, the academia, health organizations, physicians, and tech experts all together. We cannot do this alone with the traditional means, as the pace is too slow, which risk making achievement obsolete before they are all rolled out. Israel set a goal to develop and excel in the evaluation of digital health technologies, relying on metrics and outcome-based approach. This requires us to bridge medicine, IT, marketing, and economics. These tools helped us to quickly and clearly identify which programs were successful and implement them. In the exhibition outside, I'm welcoming you to see some examples of programs that we supported through research, financial incentive, and sharing know-how. Thank you for that.
Merci Israël.
Thank you very much, Israel. I shall now give the floor to Poland, to be followed by the Russian Federation, and then Turkey. Poland, you have the floor.
Merci, Chair. Honorable Regional Director, Honorable Ministers, dear colleagues. Poland fully aligns with the statement made on behalf of the EU and its member states by Czech Republic. We thank the WHO Secretariat for elaborating the action plan. As digital health was identified as one of the key elements to providing continuity of care during the time of COVID-19 pandemic. This unprecedented time showed clearly that digital solutions might be an effective measure to save lives in time of total lockdown and overloading of healthcare facilities. Polish digital health landscape rapidly expanded in the last couple of years. The e-prescription, e-referral, patient's internet account, dedicated application for healthcare facilities, expansion of electronic health record, big data analysis. These are examples of projects implemented and still developed in Polish healthcare. These projects are not only developed as a supporting tools to organize the healthcare, but also as a way to enhance protection and prevention. As an example, we have introduced Healthcare at Home platform called Home. Initially, only a pulse oximeter was used as a part of the home, but then the offer has been extended with further remote controls, like remote stethoscope, telemedicine band, and remote spirometer. The digital solutions proved to be very helpful also in managing the large number of refugees in Poland. Digital tools for pandemic management and remote healthcare were also developed at the EU level. We highly appreciate these steps. Poland is especially looking forward to the process of development of European health data space, a transparent European system of health data management and sharing, which has a potential of creating a significant value added in the process of diagnosis, treatment, and health-related research. While being very optimistic about the future of digital tools, I would like to remind us all about the challenges. Expansion of e-health solutions requires strong health data protection, prevention of digital exclusion, and close intersectional cooperation. Finally, we should remember that digital health solution cannot replace the face-to-face contact between a doctor and a patient. Poland supports further cooperation in the area of digital health in WHO Euro region and is ready to share our best practices. We are also co-sponsor of the resolution on digital health. Thank you very much.
Merci la Pologne.
Thank you very much, Poland. I shall give the floor to the Russian Federation to be followed by Turkey and then Slovenia. Russian Federation, please, you have the floor.
Уважаемый председатель,
Distinguished
уважаемые
chairwoman,
делегаты,
distinguished
стратегическим
delegates,
направлением в
the
области
strategic
цифровой
area
трансформации
of
здравоохранения
regional
Российской
digital health action plan has a number of goals, specifically in the Russian Federation, to increase digital knowledge and familiarity, reduce working time, ensure the quality of service provided to patients, and ensuring that they get information about their health status and giving them information early before they get very sick. These goals are carried out through two main projects. First of all, the creating of a digital health database on the basis of our government platform and a medical platform for the federal domestic level. We have a plan of action to implement our strategic priorities, and this is fully aligned with the strategy for digital health transformation, which exists for the Russian Federation. We believe that these principles and the concept and the strategic priorities of the regional plan of action will help member states to implement and bolster their capacities and to better digitize and improve health at the end, and also to agree on how they can give resources to the digital health and how they can match true needs and, of course, respect the principles of human rights, equality, transparency, etc. We believe that we should support mutually beneficial cooperation in this area, particularly in data exchange and in looking for the best possible projects to digitalize health and provide good service to patients, improve medical care, and help medical workers. We note the importance of having maximum use of the capacity of the block of knowledge in digital health and to assist access to e-medical health services for the population of the Euro region. We would ask that the Secretariat, in working with countries, to focus particularly on looking at how they can reduce digital health barriers and ensure digital health equality. I thank you very much for your kind attention.
Merci la Fédération de Russie.
Thank you very much, Russian Federation. I shall now give the floor to Turkey, to be followed by Hungary and then Georgia. Hungary afterwards, but first, Turkey.
I'd like to start by thanking the Secretariat for the draft regional action plan. Healthcare is an ever-changing industry that is bound to adopt new health technologies. Ongoing burden of pandemic and abrupt disruption of healthcare left long-lasting effects everywhere and created an urgent need to invest in digital health, particularly in practical solutions like telehealth. In this environment, access to digital health, safety and ethical issue of these digital health solutions, digital health literacy, data exchange and integration of new technologies become important. That's why, as a region, we need a roadmap to manage these high-speed changes to drive sustainable innovations to health threats and close the gaps within the region. Turkey has been investing in digitalization of healthcare system, especially since 2011. We established a digital platform called ePulse, which contains every citizen's health records, imaging data, etc., and any individual may share these information with healthcare professionals in the limits of their individual consent. And nowadays, 67 million of individuals are using it on their mobile phones. It eliminates unnecessary testing, imaging, and waste of time, and empowers our end users. Building on this, we also intensified our efforts on mobile apps, especially during the pandemic, in order to increase access to services and control the course of the pandemic. We are also working on regulations for telemedicine with the technical guidance of WHO. We are appreciative for this. That would take a substantial amount of load from healthcare workers and increase access to healthcare services for the public. In line with our digital transformation, we are increasing numbers of our hospitals that have level 6 and 7 certifications of digitalization of care. To exchange of knowledge and experience with countries and the private sector, we have been hosting annual HIMSS Eurasia conferences. Turkey welcomes the draft regional action plan, its vision and strategic priorities, actions and implementation guidance. We would like to learn more about the illustrative action to establish a digital health partnership council. Thank you very much.
Merci. La Turquie.
Thank you very much, Turkey. I shall now give the floor to Hungary, to be followed by Georgia and then Albania. Hungary.
Je vois que
I seem to see that we have a seat that has been vacated. Therefore, I suggest that we move to Kazakhstan. Kazakhstan, you have the floor.
Уважаемые коллеги,
Distinguished colleagues,
для меня большая
distinguished
честь
guests,
приветствовать
it is a
вас от
great
лица Министерства
pleasure for
здравоохранения
me to greet you on
Казахстана.
behalf of the Ministry of Health
В
of the
первую
Republic
очередь,
of
я бы
Kazakhstan.
хотел
Allow me
отметить,
first
что
and
мы
foremost
поддерживаем
to note
необходимость
that we support the
совместных
need
действий
to work
по
together
развитию
in
цифрового
order to develop digital
здравоохранения
health
в европейском
in
регионе.
the European
И
region.
рады,
And
что
it's a
Всемирная
great pleasure for
организация
us that the World
здравоохранения
Health
выступает
Organization
площадкой для
is
взаимодействия.
working for collaboration in
Я
this sphere.
уверен, что
I'm
региональный
convinced
план
that the
действий
regional plan
по
of action
цифровизации на
on digital health
2023-2030
for
годы послужит основой
2023-2030
для
will be a
укрепления
basis, the interpreter
существующих подходов
apologizes,
и
the sound is
обеспечения
poor, and will help
дальнейшего устойчивого развития системы
future sustainable
здравоохранения.
development of
На
World
примере
Health
Казахстана
altogether.
можно увидеть,
On the
как
example of
цифровые
Kazakhstan, we can see
интервенции
how
не просто
digital health
поддерживают,
interventions not only
но являются
support, but
ключевым
also are a key part and parcel of and driver for the entire health system and for ensuring and monitoring the quality of services provided as well as access to those services and the coverage of those services. The importance here is that the digital health system was underscored during the pandemic because there was a need for further increasing the effectiveness of services that were provided on the basis of proof. For example, decision makers based themselves on data from digital health and from informational systems in order to increase knowledge and come up with pragmatic measures to prevent and respond to different diseases and to control diseases. So digital health measures and instruments help us to fight the COVID-19 pandemic at all levels of health, from diagnostics to remote service and care. So the pandemic was a stimulus, a driver to focus more on the digitalization of health processes and come up with a way to fight and combat emergencies through e-health. We carried out a number of digital health projects with our neighbors in other countries, and we would welcome more cooperation and the expansion of those projects to the entire Euro region. The Ministry of Health of Kazakhstan is working actively with the WHO to strengthen our national medical information system, management system rather, and digital health system. And I am sure that on the basis of data exchange at a regional level, we will be able to create a lasting foundation and basis for health and improve the health of all people of the region. I wish participants of this session success, and I thank you very much for your time and for your active participation.
Merci le Kazakhstan.
Thank you very much,
Je passe
Kazakhstan.
maintenant la parole
I
à
shall now give the floor
l'Allemagne
to
qui sera
Germany,
suivie de la
to
Roumanie
be followed by
et du
Romania,
Luxembourg.
and then
L'Allemagne, vous avez la
Luxembourg.
parole.
Germany, please.
Herzlichen Dank, Frau Vorsitzende.
Thank you very much,
Deutschland
Chair.
schließt sich dem
Germany aligns
Statement
itself with the statement
Tschechiens,
made by Czechia,
dem EU-Statement
the
vollumfänglich an.
EU statement.
Digitale Gesundheit ist
Digital health
wenn nicht das
is one,
Zukunftsthema
if not
überhaupt.
the subject for the future, and there could probably be no better place than here in our host country of Israel to get an idea of the possibilities that e-health opens up for us. So it's a very important signal that this regional committee is looking at this issue and discussing this action plan. Germany would like to thank the regional committee for the draft action plan and supports its adoption. Thank you.
Merci l'Allemagne.
Thank you, Germany. I shall now give the floor to Luxembourg, to be followed by Spain, and then Austria. Luxembourg, please. Madam Minister.
Merci beaucoup. Donc,
Thank you very much.
s'associer également à la
We would also
déclaration
like to align
qui a été faite par la
ourselves with the statement that
République
was
tchèque
made
au
by
nom de
the
l'Union
Czech
européenne.
Republic on behalf of the European
Et souhaite
Union,
insister que la
and
pandémie
we would like
nous
to
a
underscore
bien
the fact
montré
that
le
COVID-19 as a
retard
pandemic
que
demonstrated
nous
the
accusons de notre
gap and the delay that we have in the digitalization of the health sector, at least in certain spheres. While the process has accelerated since 2020, we are still very far from One Health being digitalized. We are developing things, we are using them, but we're not necessarily having digital health fully integrated in our health system. And unfortunately, the pandemic actually worsened or led to delays in that rollout, even though we are making efforts. Pursuant to the vision of the WHO to improve health for all, Luxembourg aligned its vision for digital health on the 4 priorities that were outlined in the Regional Digital Health Action Plan of the WHO. We are thus looking here not only to integrate new technologies, but we cherish the hope that we will be able to bridge gaps with these tools, these digital tools, in the sphere of health. And this would benefit both the entire system of healthcare providers, but especially there of patients. This is part of our strategy at a domestic level for digitalization, which is to devolve to a national digital plan, and which also covers access to data. We have a number of infrastructure progress points that have been made over the last few years, and we need to improve healthcare, of course, while at the same time allowing economic opportunities and research opportunities to be furthered in order to correlate medical and non-medical data, and in order to have new analysis of data and new diagnoses, and especially to move from preventative medicine to predictatory medicine, and better predict diseases, we need to use this data. To facilitate this evolution, we are currently doing the following things. We have a national data plan in order to share data in a safe way between different stakeholders of our system. And as part of this, I'd also like to mention the fact that we're in contact with the Euro WHO office, and I'd just like to take the opportunity here to thank them from the bottom of my heart. Thank you very much. Thank you for your recommendations. I thank you very much for your kind attention.
Merci.
Thank you, Luxembourg. I shall now give the floor to Spain, to be followed by Austria and then Sweden. Spain, please.
Thank you, Chair, dear colleagues. In the current healthcare context, digital transformation is a fundamental step towards achieving a more efficient healthcare system with a preventive approach that ultimately will contribute to improving people's health. I would like to acknowledge the conclusions and valuable ideas proposed in the Regional Digital Health Action Plan for the WHO European region, as we consider that this could be an opportunity to continue building our digital health space, highlighting the necessity of developing digital health standards, including a standardized nomenclature and the essential alignment with the current European Union initiatives, particularly with the European Health and with the future regulations for a European health data space. We would also like to stress the need for a wide consensus on the definition of the measurement framework to monitor digital health and the necessity of focusing on the vulnerable population and promoting access to digital health services while protecting people's privacy and intimacy. We also want to highlight the need for a broad consensus on the definition of the measurement framework for monitoring digital health and the need to focus on vulnerable populations and promote access to digital health services while protecting the privacy and intimacy of the individuals. Spain agrees with the proposal and shares its main objectives, since many of the specified proposed measures are being implemented in our country thanks to a new digital health strategy approved in December 2021, which is the key to address our digital transformation in a standardized and coordinated way. The Spanish strategy aims to develop digital health services by involving people in their health care and disease control, with a special focus on equity, as well as ensuring the interoperability of health information to boost data analytics related to the health determinants and public health. Thanks to this strategy, we are now developing new specific projects and structures, such as a new national space for health data. Therefore, we do believe that the proposed Regional Digital Health Action Plan for the WHO European Region 2023 to 2030 could be an opportunity to speed up our national strategy, and we can be ready to share our experiences and good practices in the framework. Thank you very much.
Merci l'Espagne.
Thank you very much, Spain. I shall now give the floor to Austria, to be followed by Sweden and then Montenegro. Austria, please.
Thank you, Chair. Austria aligned itself with the statement made by EU and its member states, which was presented by Czechia. Austria welcomes the action plan. It is certainly an important step, and digitalization is intended to be an important pillar of healthcare in Europe and beyond. The COVID-19 pandemic showed us that quick and reliable access to healthcare needs to be ensured in order for quality of healthcare also to be ensured. The use of health data has demonstrated its potential, in particular for decisions in crisis situations, taking care of patients, research, innovation, as well as putting together statistics and public strategies. It's important that the strategy should be in line with the wishes of our citizens and carried out according to their needs. The needs and rights of citizens must clearly be at the center and cannot be placed behind the needs of market economy. Citizens must have control of their data. The explicit focus on equal rights and human rights in the action plan is welcomed. At the EU level, we are currently working on an EU framework for health data, and it has roughly the same aims as in this WHO action plan. In specific terms, control of all personal health data, as well as improving primary and secondary use of health data. For the future of digitalization in the health sector of the European region, it is absolutely key that we don't reinvent the wheel, but that we build on existing solutions so that differences in the EU region for the well-being of all can be overcome as quickly as possible. Even if Austria is a fragmented and therefore complex healthcare system, we were able to implement the Electronic Healthcare Act successfully during the pandemic. This step ensures that we will be able to continue improving continuity and therefore the quality of healthcare services on the national level. Austria is fundamentally ready to share its experiences with the Electronic Health Act, in particular concerning the rights of its citizens, and would be happy to share this with other member states of the European region. Thank you very much.
Thank you very much, Austria. Given that the list of speakers and those who wish to speak is now shortened, I would suggest that we continue the debate, which would mean that the coffee break that was envisaged for 15:30 would be postponed. So I suggest that we have it when we finish this agenda item. Therefore, I will now give the floor to Sweden, to be followed by Montenegro and then Greece. Sweden, please.
Thank you, Chair. Sweden aligns itself with the statement made by Czechia on behalf of the EU member states, and also we are aligned with the Nordic-Baltic statement. Let me be brief. Sweden welcomes the Regional Digital Health Action Plan and would like to point out a few important deliveries that will be significant for our region in the coming years. Sharing experiences and use of digital health tool is key when it comes to implementation of digital technologies. In that work, we have to consider cultural transition as well as technical transition. It is important that we learn from both successful and unsuccessful implementation of and investment in new technology, and that we support each other in the technical development of our health systems. We are proud to be collaborating with the WHO Secretariat in sharing expertise when it comes to digital healthcare solutions to strengthen healthcare delivery in rural areas. We hope that this collaboration can inspire also other health systems. Collaboration in the development of digital tools can also contribute to increased patient involvement, better interoperability and interfaces with usability for all. These are important gains on the road to a more accessible and sustainable health system. Digital inclusion is another key aspect. We know that the use and implementation of digital tools varies across member states and varies also across population groups. Policy development, regulation, and technology development must be also in sync, and the goal must be to develop services that are both accessible and affordable to us all. Finally, Sweden would like to co-sponsor the resolution. Thank you.
Merci la Suède. Je passe maintenant la parole au Monténégro qui sera suivi de la Roumanie. Le Monténégro, vous avez la parole.
Montenegro, please.
Thank you. At the very beginning, let me express our satisfaction with the emphasis the regional director has put on recognizing the value of data and digital health through the digital health flagship and the need for countries to invest in consistent and standardized approaches to digitalizing their health systems. Montenegro would like to see WHO Europe take a greater leadership role in the area of data and digital health and invest in additional staff and resources to support further development of this area, including guidance and technical expertise when and where it is needed to help transform our health system using safe and effective digital health solutions. We need the WHO to convene the relevant partners and help us contextualize evidence-based approaches for digitalization into our own health environments, building on what we have today to leapfrog up the digital adoption curve and to avoid the pitfalls and potential harms to our citizens. We believe much more can be done to accelerate the delivery of equitable access to care through digitalization, and that's the best way of achieving the core pillars which the European Programme of Work puts forth is to do so digitally. Unlocking the power of data could have helped us to a much greater extent during the COVID-19 pandemic, and we need to be better prepared to access to high-quality health data for routine care, for policy making, and for tackling the health security challenges which the region will face in the future. The last but not the least, We express appreciation to WHO confirmed readiness to support Montenegro in developing the national digital health strategy as a strategic roadmap to foster innovation and harness the power of technology and to support high quality, sustainable health and care for all today and into the future. And thank you one more time.
Merci le Monténégro.
Thank you, Montenegro. I now give the floor to Greece.
Merci. Good afternoon, everyone. It's very important tools that digitization has brought to medicine, and Greece in particular has made huge steps in digitization over the past 3 years. We have used the digital tools to create a very successful vaccination program, which involves every person living in Greece, but we have also introduced not just e-prescription, but paperless e-prescription, so any patient can have a prescription by his medic anywhere in Greece and can get it from any other city in Greece, which helps a lot. Also, there's a huge record of data because everything is kept on a registry, so we know what the patients receive. There's a huge history of every prescription for tests or medications, and this helps a lot with the patient files. So, and this has been done through these challenging times of the pandemic, and it is very important. So we are also using telemedicine in Greece because, as you know, we have a lot of remote islands and remote villages. So every island on the Aegean is equipped with telemedicine, and doctors or even nurses there can use that to get in touch with other physicians or healthcare facilities and help the patients better than could be possible in a remote area before. So this is important. The registries are also going ahead. We have a registry for CF, for depression, and many other registries that are being kept in Greece. So I think we all think that leveraging these tools that are available to us through technology is a huge step forward in medicine, a huge step in helping people also understanding the value of new medications, of all new things we can offer for our patients. And also it helps us get together. For example, we can do tumor boards being in different hospitals or even different cities and help the patients understand better how to, and help our patients get the best of treatments. So I think this is a tool that gets into prevention areas, into many other areas, and we're accelerating our efforts, and we also support the adoption of the regional digital health action plan and commit to its implementation. Thank you.
Merci la Grèce.
Thank
Je n'ai
you,
plus d'États
Greece.
membres qui
I
souhaitent
have no
s'exprimer sur
more
ma
member
liste. Est-ce que
states
c'est
on
bien
my
le cas?
list
Est-ce que
wishing to take
quelqu'un
the floor.
souhaiterait
Is
donc
that the
prendre la
case? Would anyone else like to take the floor?
Je vois que ce n'est pas le cas.
Seeing that this is not the case, we will now move on to our international partners, and I have the pleasure of giving the floor to the World Bank.
Merci. We commend WHO for putting forward the first ever digital health action plan in the Europe region. This is a critical investment in transitioning health systems into the 21st century and in delivering value for money and meeting the healthcare needs and expectations of the populations across our client countries. The challenge the World Bank and our client countries face in moving from a digital health approach to a digital in-health approach. By this we mean digital in-health financing, digital in-health service delivery, digital in preventive, diagnostic, and curative health care, digital in primary health care, digital in-health workforce planning and management. Our objective should be to keep a laser-like focus on health and health system challenges that need to be resolved, to apply global best practice solutions of what works and how it works to resolve the specific problems identified.
We need to move beyond pilots, beyond freestanding applications, and narrow focus on technology. Digital solutions for health need to be based on a country's overall foundational digital architecture, governance, and interoperability. As country works to define what digital means for their own health systems, they need to create an integrated foundational elements of digital information systems, from patients to providers to payers, to create new ways of reaching people that need help the most, and to get them more value from existing data systems to steer healthcare improvements. To drive systematic, system-wide improvements, we are focused on financing comprehensive digital in-health solutions, not only ICT software, through World Bank projects across countries in Europe and Central Asia and elsewhere.
Je vous invite
We
à
look
conclure, s'il
forward
vous
to
plaît.
continuing our work with WHO, our partnership both at the regional level and in countries.
Merci. Je passe maintenant
Thank
la
you very
parole
much.
au Comité
I now give the
européen des
floor
régions.
to the European Committee of the Regions.
Thanks. And I stand here today as a member of the European Committee of the Regions, the European body representing the 1 million territorial politicians who are elected to run their villages, cities, counties, and regions, chosen by our citizens to act on their behalf on hundreds and thousands of local authorities. We work for the territories on the ground in Brussels. This includes, of course, health. As you may know, the management of health system is actually decentralized in the majority of the EU member states. In plain English, it means that the health policies and programs are designed, delivered, and funded by municipal and regional councils. We are the very people who finance hospitals, roll out prevention programs, and deliver healthcare services. Today, I want to tell you about our ongoing work on the new proposal for EU law called European Health Data Space. Let me put it in a perspective. My credit card is valid all over the world. With my driving license, I can rent a car everywhere. I can cross borders in EU with my ID in hand. I can use my mobile banking app to check my account. But I still cannot access my medical file. If I need to see a doctor on my trip to Brussels, they will not be able to consult my records from Sweden. If we do an emergency X-ray in Italian, my doctor in Gothenburg will not receive a copy. Health data in the EU are still in silos, disconnected, dispersed, and inaccessible. We want this to change. And I see the time is nearly out, so we work for this, and we need to digitalize our health data and make them accessible, secure, and exchangeable. This is the new future, and thank you for your attention.
Merci beaucoup.
Thank you very much.
Est-ce que d'autres partenaires internationaux
Would
souhaiteraient
other
s'exprimer?
international partners like to take the floor?
Je n'en vois pas, donc je
see
passe
none.
aux acteurs
So,
non
I
étatiques.
will now
Je me
move on to
permets de
non-state
rappeler qu'un
actors,
certain nombre
and
d'entre
I would
eux
like
ont
to
publié
remind us all that some
des
of them
déclarations ou transmis des
published
éléments
or
par écrit
sent
ou par vidéo.
written
Et je vous
statements
invite
or video
évidemment à
statements, so I would
les
of course
consulter sur le site
invite all
internet
of
du
you to
comité
consult
régional.
these
Je
on
passe
the
donc
RC
la parole à
website.
Madame
So I
Caroline
now give the floor
Costanz
to Ms.
qui va
Caroline
s'exprimer au nom de
Costanz, who will be
29
speaking
acteurs
on
non
behalf
étatiques.
of 29 non-state actors. You have the floor.
Dear Chair, Regional Director and distinguished delegates, EuroHealthNet and the 29 other non-state actors welcome the Digital Health Action Plan and its vision to improve health outcomes for everyone, everywhere, equitably. Indeed, without mindful implementation, the digital transition will leave people behind and exacerbate health inequalities. We therefore welcome the inclusion of action on digital health literacy and recommend advancing it as the foundation of successful and equitable uptake of digital health solutions across society. Furthermore, we recommend elaborating on the following 4 elements. First, a focus on the up- and reskilling of the European health workforce. And this can be done by ensuring availability of tools and resources, such as those developed by the new EU-funded Be Well initiative. Second, to design clear mechanisms to safeguard privacy and trust, and which also permits for meaningful and inclusive public and patient involvement, and for consistent access to data for research across member states. Third, also provide guidance for engaging with industry and establishing labeling and certification schemes to help identify trustworthy digital health tools and applications, such as done by the new Label to Enable initiative. Fourth, ensure standardization of digital tools and technologies for greater accessibility and transferability, both across countries as well as sectors. In particular, integration with social services and social service innovations is particularly critical. And finally, we welcome alignment with the European Union strategies, and in this regard, the non-state actors have an important role to build bridges and to promote dialogue. Our resources and networks offer rich insights and tools to be leveraged for the plan's implementation. And we call upon you and others to take advantage of all the opportunities to translate the plan into practice. And we hope further exchanges and meetings will be convened to achieve an equitable digital health transition. Thank you.
Merci beaucoup.
Thank you very much. So I will now close the debate.